Okay, hopefully this is going to work. The long and short of things is I had a conversation with my father whose kidneys have improved again. So they've gone down, which in this case is good, on the level of how damaged they are. So he's now down to the number two. And so he's making good progress. But we had a very good conversation regarding medication and different drugs, because different doctors requiring you to stay on drugs, because he was prescribed a medication, which obviously they don't want me to say it, but it was a very common one for diabetes. And I told him, no, you don't do that, because all the paperwork shows that it has a negative impact on your kidneys. And so you shouldn't do that. So his primary care has said, hey, do this. And then the nephrologist said, don't. It has a negative impact on your kidneys. Now, I say that because a primary care is not a specialist. They're generalists, and in general, they know things. They may not keep up with every white paper on every disease that's out there. That's why you have your rheumatologist, you have your neonatal doctor, you have your cardiologist, your neonatal pediatrician is what I was going to say, your nephrologist. You have all of these doctors who specialize in different things, as well as you have dietitians, you have ortho practitioners, you have different holistic medicine doctors, functional medicine doctors, you have nurse practitioners, you have people who specialize at different levels. And that's why you need a village. You need a holistic approach. If no one's looking at everything that's happening, you're going to end up with someone prescribing something that's going to do more harm than good. And I also had a conversation with him about hormone therapy, because sometimes hormone therapy is prescribed, and some of the hormone therapy actually impacts your kidneys, or it impacts your liver, or it impacts your pancreas. So there's multiple levels to it. So you have to look at the quality of life, look at the organs themselves. They are not meant to survive forever and ever and ever. So with age, yes, their functionality might decrease, not to where it's drastic to where you're going to not be here the next day, but sometimes medical intervention in the form of pharmaceuticals is not the answer. Sometimes there's herbs you could take. Sometimes there's meditation you can do. Sometimes there's stress relievers. Sometimes you need to go do some walking, some grounding. Sometimes you need to go do some water aerobics, because you don't need to be outside in the sun, depending on what medication there is. So managing health is a holistic thing. And I know, because my goal is to get to the root of things, most doctors deal with one problem at a time. And sometimes they'll give you, like a generalist will give you medication for 3 different problems, not really take into account that those medications will in turn bring about other side effects that make you have to take more medication. Whereas I know my rheumatologist, when we had me on a particular medicine and it caused the vision loss, he was like, cut it out. Not, hey, let's just throw you on a medicine for vision. It's like, let's stop the drug that's causing the problem. He's a very good doctor, but he also believes in functional medicine. So he also recognizes and appreciates my degree, and actually we have intelligent conversation about the direction of my care. Okay, so healthcare in general needs to be something that you take charge of, that you keep up with, that you tell the doctors that, no, I'm not going to do this, because I'm not even going to try it, because I don't like the side effects. We also had the other conversation about the trials that are done. And you must understand that the trials are not necessarily done on every demographic, right? A lot of trials are done on college students who are getting paid to be a part of a trial. And those students don't have the same issues that you have. So whether or not the drug is going to impact them the same way it would impact you, who knows? You got to look into all of that. Now, the medical community knows what I mean when I say there's a white paper for that. A white paper is a research paper on a different topic, right? So lately, the whole thing came out with acetaminophen. Well, there's some type of white paper out there outlining why they think this drug is bad. My thing to you is that most of these companies knew that these drugs were bad on multiple different levels, but they decided that the risk or the reward outweighed the risk, right? So just because somebody's telling you something today, whether it's true or not, I take it with a grain of salt, because everything is bad for someone and everything has the potential to be good for someone. You have to know, is it good for you? As a Black American, there's a lot of things that we are given that is not good for us, because our bodies are different. That's just reality. That's science. So the drugs impact us in a different way, and the mortality rate is higher for us than other people, right? So that says right there, obviously we shouldn't be doing the same thing that other people are doing. And I would say to anybody, that's the same thing for you. Your genetic makeup, not just a white American, but you might be a white American who's from Australia originally versus a person who's from some part of Europe, versus where you are from, and your DNA has a huge part on your health and the ability to treat and heal parts of you. Again, I can tell you in science, historically, they used to have a lot of different things that would say like a reference range, and the reference range would be based on what they consider race and nationality, because the ranges were normal in certain populations, whereas abnormal in other populations. That's life. The bottom line is you have to pay attention to you and know what your makeup is, know what your culture is as to what things have not gone well for your culture, and what you are willing to do and not do, and be an advocate, be extremely vocal, and be present in your care. All right. It's a lot of information I've given in this, all to say you have to be your own patient advocate.